Just don't F me up.
Welcome back to the shit show, everybody. Just Don't F Them Up podcast. We're back with another incredible guest today. I'm so excited.
So,
Mackenzie, you want to introduce?
say magnifique. We have Dr. Anna Bohlinger from Children's Minnesota. She is an LMFT, the lead program therapist at a partial hospitalization program. So, very niche, specialized program. And let us start by saying thank you for coming, Your Highness.
That's really funny. I'm I'm delighted to be with you guys. Thank you for inviting me to be on. I'm excited to talk with you all a little bit about short-term mental health care and especially family therapy. That's my favorite thing.
Awesome.
I've been so excited to hear about what you do and what it looks like. I work in this field and I don't know what a partial hospitalization would look like for a kid.
Oh yeah, that's a great question. So levels of care in Minnesota there's like the highest level of care in Minnesota is inpatient Black psychiatric care. The lowest level of care is outpatient therapy. So seeing a therapist once a week or every other week, or seeing a psychiatrist, sometimes once a month, but usually once a quarter. So once every 3 months. And then there's different levels of care in between LACT inpatient psychiatric care and that outpatient level of care. Partial hospitalization is usually thought about as kind of one step lower than that LACT psychiatric unit. Mm-hmm. And so when I think about it like a triangle that you sort of flip upside down. So highest level of care, top of the triangle, is that LACT psychiatric care. Now, if you flip that triangle upside down and imagine the narrowest point of the triangle on the bottom, think about that as like the scope of services or the scope of what's like inbounds, out of bounds for therapy. So the goal of inpatient Black psychiatric unit is going to be to stabilize the like immediate safety crisis that brought the person to the hospital. So like you just attempted suicide. Let's get you medically stable. Let's get you started on some medications and let's get you some really quick crisis coping skills to help you stay safer. And once that's stabilized-ish enough, then you're on your way. So for adults, an LACT psychiatric inpatient stay is usually, 3-4 days, sometimes 5 days. For children in Minnesota, it's usually 5, 7, sometimes 9, rarely 10 days. It's really, really brief. Okay. And important to know with like something like partial hospitalization, it's also very brief. So the program I work in, our length of stay is like 3 to 5 weeks. Sometimes in the metro you get to like 4 to 6 weeks, but it's not like therapy. I've been seeing my own therapist for 2.5 years, and we talk about nothing for 45 minutes and sometimes I leave and I'm like wrung out and so sad, and like talk about anything and everything under the sun. A short-term mental health care is really not like an everything under the sun mode of treatment. It's to help people kind of get stable with the most immediate things that are going on so that they can go and benefit from a lower level of care and continue doing that work that's like broader and the work that makes your life whole, good, sustainable. But it's really not meant to be curative. It's meant to like stabilize immediate concerns. Okay. The other thing that I really want to be clear about with what is partial hospitalization versus inpatient, and I keep saying that like LACT psychiatric emergency kind of level of care, because I think sometimes people hear, oh, it's like an inpatient stay, and they imagine like an inpatient rehab in Malibu where you like up and there's 2 beautiful palm trees outside the gate, and you roll in and there's like celebrities,
a pool.
Like a pool, right? I mean, like Minnesota's not known for its palm trees. Black psychiatric, it's not generally overwhelmingly pleasant. Like when you're there, you need to be there. It's not like a spa or like getaway experience. It's really It's hard to be in the circumstances that that bring you there, and it's hard to be there once you're there, 100%. But really important for me to say about partial hospitalization, one thing that families often get kind of worried about is like, oh my gosh, it's hospitalization. My kid is going to be staying overnight somewhere for like 3 to 5 weeks. No. This is a day program. So kids get here at 8:30, they leave at 3 p.m. They're home in evenings, weekends, we're closed, day of holidays. We have had snow days, and so it's like school time hours about.
Yeah.
Okay. So what about school? Like,
Yeah, great question.
yeah.
So part of what justifies the need for partial hospitalization generally, so the thing that you're thinking about when you're thinking about, oh, wow, does this kid really need this? Because you think about those two triangles, the highest level of care has the narrowest scope. The lowest level of care, anything is on the table and everything is on the table. We want kids to be at the lowest level of care that they can possibly benefit from. We want kids in their communities. We want them in their schools. We want them with their families. We want them dealing with like those ordinary stressors that come up in a kid's life. Like, I'm bored and I'm not allowed to use my screens yet, or I have to go grocery shopping. They're like,
I feel that.
yeah, my 3-year-old is all about grocery shopping still. Like, this is like her favorite place in the world is like, let's go to the grocery store. And my 10-year-old has absolutely had it with Hy-Vee.
I'm not going there. I'm not even going to look at it.
And I mean, yeah, why are we really doing another Target pickup? Is this necessary? But like practicing those ordinary stressors, like I have to go and run errands with my family. Like that's where life happens for kids, and like, so long and the short is like for all kinds of reasons, like clinical, financial, and just like what is the right thing for kids and families and communities. We want kids with their communities as much as possible.
Yeah.
So like if your kid doesn't need a higher level of care than what they're at, like trust the people that are saying like, no, keep trying therapy or keep trying intensive outpatient level care, which is kind of between partial hospitalization and outpatient. Because kids get sicker faster if they're at a higher level of care than what they need. So Miranda, you asked the question about school, like, well, what happens with school? Well, kids are in something like partial hospitalization. Typically programs, and this program included, will have some amount of academic involvement. And so the program I'm in is contracted with the local school district, and a teacher comes in and provides an hour of academic services each day. But it's a 7-hour, 6.5-hour day. The majority of the day is like skills groups, recreation therapy groups. They have daily group therapy. There's like a nursing-led group that's like wellness and that kind of stuff.
Wow.
The real minority of the day is like academic services. Because part of what justifies the need for partial hospitalization is that your kid can't swing it in school, and so if your kid, so occasionally we'll get a question from a parent that's like, this happens more with kids who are like older, 16, 17, 18 sometimes, because you can be in the program if you're 18, if you're still a senior in high school. It's like, oh, my kid has had this happen that have been really, really stressful, really hard. They're really having a tough time, and, we really want them to continue in like AP biology, so can they do AP biology while they're in the program? My answer to that and my colleagues' answer to that is typically like, look, if they can do AP biology, they don't need to be here. And so like, keep them at that lower level of care. Like, don't, this is not necessarily a more is more situation. Like, you really want to get kids at the level of care that they need. And partial hospitalization is something that, like, thankfully, most kids in Minnesota are not going to need. Inpatient, that lacked inpatient psychiatric care, most kids in Minnesota, most kids in the United States are never going to need that. We know that about 2% of youth in the United States need inpatient care in any given year. 98% of kids don't. So I think this is like conversations like this, they're tough needles to thread, because on one hand, these problems are more common than we realize or like give credit for. There's all kinds of nuance and problems, so there's the Minnesota student survey that's like conducted with schools across Minnesota, public, parochial, the whole kind of kit caboodle. And that study in 2019 demonstrated that like something like a third about of Minnesota ninth graders had thoughts in the previous year about harming themselves.
A third?
Yeah, but this is a thought. A thought's a thought,
Mhm.
right? You know, and then the kids that act on those thoughts, it drops to like 5 to 7% or something like that.
Oh, wow.
So I think that's like important to keep in mind, you know, because like, I don't know, my oldest, like I said, is 10, so she's kind of edging into tweendom. And I've been working in children's mental health like for 17-ish years, and almost all at like high levels of care, you know? And so I have lots of experience working with like suicide and self-injury and this, that, and the other, you know, and these like really intense, scary experiences that kids have. And so, and there's not a lot of me that gets like super, super flustered with things like that professionally. And like, if my own kid is like, hey, I'm having a really hard time with like this or that or the other, like it strikes in something in me that's like really different than like anything professional,
Mhm.
you know? And so I say all that to say, like, having scary thoughts is sometimes a part of being a person,
Mhm.
and having scary experiences is just about all. I mean, we will all be scared. That's, you know, we have this like corporal form with all of its like pros and cons. And most kids do okay ultimately, you know. And so you might be listening to this and be a parent who has had a kid who's been in partial multiple times and has been in residential, and they've had multiple inpatient hospitalizations and that kind of thing. Part of what those statistics really highlight for me to those parents is just how so important it is to develop community that understands what you're going through.
Mhm.
And I think it's profoundly validating of how lonely these experiences are for kids and families. Because if 98% of kids never need any level of like inpatient care, of course it's hard to talk to your coworkers about it. Of course it's hard to ask for FMLA to go to appointments. This is not a maternity leave.
Right.
Yeah. And so, and I think there's a part of it that's also hopefully like kind of reassuring to the general public that like, because I think sometimes like mental health communication and science communication can be kind of fear-mongery and like, you know, oh, your kid is giving you the stink eye, you should probably hospitalize them. You know, you don't always see that, but like that can kind of be the feeling. And like kids give people the stink eye. That's not an emergency, you know?
Yeah.
Like a third of kids will have thoughts about harming themselves. Very, very few of them will act on those thoughts. And of those that do, even fewer will need to be hospitalized. You know, and so like one, I had like kind of had these two goals. Like one, the families that are in these tough positions and find themselves in them again and again and again, like, oof, these are hard roads. I really want families that are listening and are in that position to know, like, it's not just like hard because it feels hard. It's like statistically hard. It's statistically lonely, right? And for other parents that are listening and they're like, oh, I've never heard of a partial hospitalization level care. What does that even mean? You know, my hope is that you never know, right?
Right.
And you probably won't in all likelihood, like statistically. Your kids are probably going to do okay. Most kids do.
But I think it's still so helpful for people to just have an understanding of like what these things are. So the people who are going through this and the families who are experiencing it maybe feel a little bit less lonely because people aren't like, oh, so your kid is gone then for 3 to 5 weeks in this program, or you know, like just is confusing. And there are a lot of things like we understand a lot of things because we work in this field, but we're still confused by some of it. And so the general public isn't going to know what these things are or what they entail, what that's going to look like. And so I think talking about it in this way is just so helpful because it just gives everybody a basic idea and a basic understanding.
For sure. Yeah, one thing that's been really interesting in the past, I started working when I was 20, so you can do the math. I'm 37 now. When I first started working, kids would like never tell people where they were. And I was working in residential treatment at that time. And which like, I mean, Miranda and Mackenzie, you guys know insurance. Like insurance is what it is for good, for bad, for all of the in between, right? And it was back then, like length of stay for children's residential was very long for good and bad reasons. But like 6 to 9 months, 9 to 18 months was not unusual. Residential is this kind of like, it's a weird, like, you have a kid that's like in and out of the hospital a whole bunch of times, and they're not kind of able to stay out of the hospital. It's usually kind of an end of the rope intervention, sometimes you look at a residential level of care. And honestly, sometimes, if you're in an area where there are no services, I grew up in rural Wisconsin. There's one therapy clinic in the county on the one highway in and out of the county with no tree cover. And so like I teach like ethics at the St. Mary's graduate program now too, as like a little side hustle thing. And so like confidentiality changes if you're in a town of like 700 people, and everyone knows each other's cars. You're parked at the therapy clinic.
Yeah.
Oh my gosh.
Right. So anyways, long and short is that when I first started working in children's mental health, kids would never ever tell other kids where they were. Like it was like this huge secret. And so I have like a distinct memory of a 7th or 8th grader who was like finishing up and like, okay, so you're going to go back to school. Like, what are you going to tell people? How are you feeling about all this? And he's like, well, I'm just going to tell them I joined the circus. And I'm going to let them know I was a trapeze artist for the last couple of years. And that's my story. And I'm sticking to it. As far as I know, he stuck to it. And, Godspeed to him.
Oh
yeah. Whereas like now, it was really interesting. Like right before COVID, it seemed like kids were like 2017, 2018, 2019. When I would ask kids in shorter length of stay, so like more partial or like shorter residential stays, that kind of stuff. Like, so what are you going to tell people when you go back? Most of them would say, oh, I was working on my mental health. And then I'd like turn to mom and dad and say, like, what do you guys know about this? Is this like a safe thing to say in your community? Like pros, cons, right? Because families are making decisions about both like safety and authenticity and like self-disclosure. So like on one hand, if you share more about your own experience, you maybe make the road a little easier for others who might have to walk it or have to like walk an adjacent road. And on the other hand, like stigma has real consequences. And so you have to like balance both. And so if you're in a community where like if you tell people you're getting mental health treatment, you're not going to get a job in the county, probably don't tell people that, and that's like an A-okay decision to make. Like your safety is the first thing, And so again, like 2017, 2018, 2019, I would ask kids, like, what do you think you're going to tell people about what you've been up to in the past, few weeks or whatever? And they'd say, well, I'm going to tell people I was working on my mental health. So I try to parents say, well, what do you think about this? Like, is this a safe decision? Your community is like, yes, it is. Kind of surprisingly, I think in the first few years after COVID, which I think we're still in, but especially like 21 and 22, to some degree 23, when I ask kids, like, where are you going to tell people about where you've been? It'd be that's kind of the circus story again, or like, well, I'm going to say I was staying with my grandma, or honestly, like I had COVID and then I got the flu, which again, like families have to make their own decisions and kids have to make their own decisions about like safety and authenticity, but I don't know what that means. So that, Brandy, your point about like, I want people to like know more about this. It's been really interesting the past like 6-7 years because I've seen this real shift in like, or prior to COVID, people were pretty willing, it seemed like, to talk about what their experiences were. And at least in these first few years, it's sort of gone private again. And that's like all anecdotal, right? Like I have no like data to support that. But I don't know what it means. I'm curious about it.
Yeah, that's just a really interesting like pattern to
Yeah.
look makes me curious too. Like, I guess I haven't had those kinds of conversations with the clients that I see.
Mhm.
But it'd be interesting to know if that's with adults too, or if it's something with kids that has shifted. Because I feel like, I mean, annoying as it is, I feel like TikTok has like,
Mhm.
it brings so much awareness to so many things. And I feel like
Mhm.
good and bad with it, but a lot of like people talking about mental health stuff, and that's a way to reach kids. And
Mhm.
so it's interesting that there's that we're seeing both.
Yeah.
Yeah.
I
Mhm.
think it's interesting that like the general public that I talk to, like friends and families who aren't in the field, during
Mhm.
the pandemic, I got a lot of questions of like, are you guys just so full because everybody needs support? And then
Mhm.
same with parents that I would know. They're like, do you guys have openings? I can't find anywhere with openings. And I feel like it was the
Mhm.
first time people in the outside world of my life were like aware of this is a thing and more people need it.
Mhm. Yeah. Yeah, it's really interesting. I don't quite know what to make out of it for sure. I wonder, like, I think there's a difference perhaps between saying like mental health concerns are a thing and people have mental health concerns, and then saying I have mental health concerns
Mm,
that are changing how I do my life. You
mhm,
know, the like TikTok thing is really interesting because I think the teenagers that I work with, like, by a lot, the thing I hear more often about like TikTok and mental health is that it makes it easier to like fake having a mental illness, is like the complaint that a lot of the kids I work with have.
Like it's
And
cool
so
now.
kind of like there's a part of it that's like a almost like a status symbol in the way that they talk about it. And so they're like kind of it's this really complicated position that the kids I work with find themselves in, because I think they both want and need like real congruent connection and like authentic relationships. And there's a there I don't know if there's like a broad like the broadening of like, oh, most people will have a mental health concern in their life or this, that, or the other, or something like that, where they feel like they have to be I don't know, like the right kind of sick or something.
Yeah,
mhm.
that's interesting.
Yeah,
That's
I
in-
don't know.
I wonder
Yeah.
how that is related to just phone use in general, because
Mhm.
we are possibly the last generation of children that didn't have like cell phones and all of the apps and whatever.
Mhm.
And now we're parenting kids that have like virtually everything at their fingertips. And
Yeah.
how much does that affect mental health? Like there's positives and challenges, and
Yeah.
like the bullying that happens on TikTok, Instagram, Facebook, the
Yeah.
things I have heard that people, I wouldn't have even known some of the words that people use when I was in middle school, and like have
Mhm.
access to like OnlyFans. I can't
Yeah.
tell you how many adolescents I have heard who feel
Mhm.
age to be on OnlyFans. I'm like, I would have, I don't even think I knew what like boobies and stuff were at that age, but like,
Right.
how does that affect if we're growing up too fast?
Yeah, for sure. Well, I think the amount of comparison that kids find themselves in, and using using social media before you really like either cognitively or developmentally have the ability have like a true ability to differentiate fiction from fact.
Mhm.
And I mean, like, adults are bamboozled by like fake news, all the time, like deep fakes, like adults are tricked by this stuff. um I think it is a really like complicated social milieu, and it's one that's like unavoidably going to be a part of our kids' development. You
Mhm.
know, one thing I am hopeful about, and maybe it's like a Pollyannish kind of hope, But I am hopeful that like, same as we're that last generation that grew up without smartphones, our kids are growing up with them. And so hopefully when they're raising their children, they'll have more of like oh, this is what this is, and this is what this means for me, and this is what can be helpful, and then so it won't be such a like foreign thing. I mean, I know technology moves so fast, and so I don't know. I remember when my spouse and I started dating, and we were like 20 and knew everything that there was to know about everything under the sun. We're like, what I don't remember, it was like just stupid stuff now in hindsight, but it was like, we won't let our kids have an iPod until they're 14, like don't
iPod?
an iPod. We're gonna be really like control their environment, and like, nobody knows anything. Right? Like, I think as soon as you think like you like have it down, like something's gonna come along and like show you the truth here,
Yeah.
we do know that like early social media use is associated with like worse and more pervasive mental health problems for kids. And at the same time, that the internet is a part of the environment. And so I think by and large, the advice to parents is from both like public health and preventative organizations and from organizations that are more like illness focused is as much as you can try to delay use, and so it makes it sound like we're talking about like a substance use thing, that delayed use language. But, like if you have a kid that doesn't have an internet enabled phone yet, they probably don't need one this year, like 14, 15 is like a fine age to start introducing that. If you can delay, like try to delay. And there's times where like parents can't, you're working like 2 shifts. Your kid stays at home in the evenings, they need to have access to like 911, and like it's kind of hard to find a phone that doesn't have internet enabled, or
I'm gonna find them though, because now
yeah.
this, and when my children get old enough to pitch a fit that they have like a like a early 2000s Motorola Razor flip phone,
Yeah.
be like, listen to this doctor who works in Minnesota. She said
Delay use.
so. Here
Sorry.
is a Razor phone, and you can
Yes.
text or call.
Yes, exactly, for sure. And I mean, I think remembering those like Razor flip phones were like the height of cool. Would I like tuck them in your jeans, like, whoa.
And then you slam them shut dramatically.
Yeah.
We're about to get cool up in here.
Yeah.
How about like academic pressures? Are we seeing a shift there in how much it's affecting our children's mental health?
That's a great question. That's not one that I hear as like a change so much, or I think about as like a change in what I'm hearing from kids and families over the past few years. I think if anything, the thing that I hear more of and that I find myself saying to families more often is like the pressure to do things like go to school every day has like lightened in a way that's probably not super, super helpful for kids that are like anxious and school avoidant. So I've always been in high levels of care. I did like do a little teensy bit of outpatient now, done like a little bit of school-based mental health. I did some like in-home when I was like a associate therapist, but mostly I've been like inpatient, residential, partial hospitalization kind of levels of care, And so the question about like, hey, should we delay return to school after this has been a question that's like perennial from 2007. And the answer, perennial, has been not by too much, if at all, because kids really need that structure. There's like a whole lot of like maladaptive feel goods with avoiding things that make us anxious, and like anxiety kind of grows to fill the space it's given a lot of the time with kids. And so for return to school stuff, the thing that I actually hear more often is like, oh, my kid is finishing this program. We're gonna like keep them out of school for a couple weeks just to give them a chance to reacclimate. And I'm like, what are we reacclimating to? because you're not going to be home. You're not quitting your job. You're not going to be homeschooling. Your kid has to return to school. This is going to be stressful no matter when it happens. It's going to be more stressful if you put it off by 2 weeks, you know? And so I think there's definitely like an argument to be made about like, hey, it's good for kids to be able to like sometimes like take a minute and breathe and like skip an activity or something like that because they're just not feeling that night. Like maybe you're not, no, very few of us are going to have kids who are like Olympic hockey players or like concert pianists. Like if they want to skip piano one night, that's probably not the end of the world. And I know there's a lot of like conversation about like, oh, kids and taking like mental health days from school. I think like by and large, that's not a super helpful practice to get into, because like kids got to do school. Going to school is a really important part of being a kid. And it gets really, really easy for kids and families to avoid the things that are ultimately going to get you healthier. And so, yeah, it's an interesting question because I think the school pressure piece, always there's been like a minority of families that are inappropriately saying my kid needs to continue AP biology. I worked in eating disorder treatment years ago and eating disorder residential, and we would have kids who were like medically not stable, who families were declining the care because they had a competitive sporting event coming up or a competitive music performance coming up, and so like that's not helpful.
Right.
Yeah.
And I understand these are hard decisions to make, or the idea that your kid will like miss senior prom, like that's really, really sad. And that's worth grieving. And if you're in that spot where that like less than 2% of kids in the United States, you got to pay attention to that, and you do eventually you got to grieve that, that like your kid missed prom or your kid missed the like all-state concert or whatever it was, so always there's been like a minority of families that decline pretty strongly recommended services because of some pressure to perform. That like percentage has like if I was gonna like anecdotally put it, it's somewhere between like 5 to 15%. It's small. So in any given year 3 or 4 families are declining really necessary care that I'm working with because of something that's like performance related. The thing that I've seen more as a change is like, performance is not so important. It's good that we like take care of ourselves, which is a lovely message and a lovely belief and a lovely practice. But like not so lovely practice is like, okay, so we're gonna miss school when we're not feeling it. Like, no, you got to go to school when you're not feeling it.
Yeah.
By and large.
Yeah.
Does that make sense?
Yes. And I feel like that's such a life lesson too. Like you have to go to work when you're not feeling it. You have to take care of your kids when you're not feeling it. You have to, like, as an adult, take the trash out when you're not feeling it. Like we have to do a lot of things even when we're not feeling it. Like there's not a choice. And I think having that like lesson just from a young age, like, yeah, some days we're not going to feel like it and just need to do it. And once we get started, usually it goes better and, all the things. But yeah, I feel like it's a slippery slope to set up the expectation that always you don't have to if you don't want to.
Yeah, for sure.
We had a teacher on a couple episodes back, and she was saying that it's common for students, if they have a dentist appointment, to just not go to school for that whole day. And we were thinking like, that would have never flown. Like, I literally remember going back to school when my face was still like Nova and I was like this, smiling at teachers, and like, I might hold a little trauma from that experience, but I had to go back to school after the dentist. And that I even wonder like how that such a drastic shift occurred And if it's our own, like our generation that was like, we had maybe more strict,
Mhm.
and if we're kind of swinging to the other side, thinking that like my kid's never going to have that experience.
Right, totally. And I think like families do that, you'll do the like, I'm never gonna be my parents,
Yeah.
yeah, like that's like it's common, so I was saying before at the beginning, I like love family therapy. It's my most favorite thing. So now I want to talk a little bit about family therapy.
Yeah,
Yeah.
I've been meaning to ask you.
So much. But I talk with families in first sessions always with like, hey, look, here's what we're up to. Here's what I think about what we're up to. I think one thing that's true in family therapy theory and practice is that family therapists do believe that there is no such thing as an agendaless therapist. Family therapists believe there's no such thing as like going into the room totally blank slate. You have a clinical point of view that's like inalienable. It's absolutely related to what you're up to. And so what I'll talk with parents about, because I always get a genogram and first appointments. I'll say, okay, we're going to talk about the family in the house. How do you guys know that you love each other and are proud of each other? How do you know that someone in the family's upset with someone else? Because one place that families get stuck a lot is like there's one kind of realm of feeling that's acceptable, and then there's all of these realms of feeling that are untouchable. So I'll say like, how do you guys know that you're upset with someone else? And they say, oh, well, we yell and we swear and fight. So-and-so throws things, or they say like, well, we won't talk to each other for days, and and da da da, and I say, how do you guys know that you love each other? And it's sort of like crickets,
Oh, yeah.
and so that's like important information. And I say to parents, I'm going to ask you guys those same questions. How do you guys know that you love each other and are proud of each other? And when you were a child, how did you know that your family loved each other and was proud of each other? And how did you know that someone in your family was upset with someone else? And a lot of times parents get kind of nervous with those questions because you're coming to like family therapy at a high level of care. Your kid is in crisis. A lot of times there's a feeling of like, let's just kind of, there's this like thread where it's like, in one way, we're going to stay focused on what's right now, but in another way, we can't get to what's right now if we don't understand anything of what's been.
Mhm.
And so I'll say to parents, the reason I'm asking those questions is most of the time, I have yet to meet a parent, either professionally or personally, who does not want to give their children the absolute best that they can imagine.
Mhm.
And we go into that imagining with what we've known. And so if things were great when we were little, we want to do the exact same. If things were terrible, we want to do the direct opposite. So I think you're right, Mackenzie. Like maybe there's a way that we were raised in this like more like restrictive, buck up, pull yourself by your bootstraps kind of like mentality. And then parents, in our generation are wanting to like raise kids with more like tenderness and care.
Mhm.
And what I say to parents in those first appointments is, things were great, you want to do the same. Things were terrible, you want to do the opposite. Most of the time, there's more than two choices. So my goal in family therapy is not that you have like a third party that tells you what to do. It's that you understand more about what you're doing, what you're doing, and why you're doing it, and what about this works and what doesn't work. So you can like go into your life with a fuller range of choices.
Mhm.
And so it makes sense to me that like, oh, you're raised in this like tough environment. So you're like, I want to be a soft landing spot and like give kids lots of room to like fail and make mistakes, and like it's okay to fail. Everybody fails. Mom, dad fail. Right. There's like space in between, like harsh, punitive, restrictive, always and forever will you do this thing, and soft, gentle, over accommodating helicopter parent. I'll make sure your life has no suffering, because that's also an unachievable promise.
Right.
Mhm.
All of our lives will have suffering. All of our kids will suffer. And I don't mean that in like sort of hypothetical, something hard will happen. Being a human means that we will have experiences that are terrible sometimes. And being in relationships, whether that's like parenting, a romantic relationship, a therapist and a client, wherever that relationship is, we can be with that suffering, and like having like authenticity and congruence can make it possible to connect in like a realer way, you know.
Yeah.
But just like rescuing someone from that without allowing them to like understand or be with like, yeah, this is really, really hard.
Mhm.
This is so tough. And it's part of being a person, you know. I mean, I think there's almost a way where if we rescue too quickly, it's really invalidating.
Yeah.
Yeah. Yeah. Well, it sends that message that they can't do it.
Well, right, you know, or like, oh, see, honey, it's not so bad. See,
Yeah.
baby, you know,
Mhm.
yeah.
It just
Yeah.
makes me think too that like it just seems like parenting now is so different than like it used to be. Because sometimes honestly, my kids get away with shit because I'm like, I'm just too exhausted to keep fighting you on this.
Oh,
Mhm.
yeah,
Like,
for sure.
and so I get that. Mine aren't doing that with like, I'm not going to school. Well, one has been a little bit, but like he's still small enough that we pick him up and carry him into school,
Yeah.
screaming, fighting, and kicking and
Mhm.
whatever. But like,
Mhm.
if your 14-year-old is doing that, that
Mhm.
would be a bit different. And if you're
That's
like,
totally different.
then you're not gonna have your phone, fine. Then you're not gonna whatever, fine. Then you're not gonna.
Mhm.
Then it's like, what do you even do? You get to the point where I'm sure as a
Yeah.
parent, you're like, fine, you deal with the consequences of not being at school then. And
Yeah, for sure, totally. Yeah. And sometimes that's what we like when parents are in that spot in this program or other programs like this. A lot of times we'll advise parents to like, don't rescue your kid from these consequences.
Mhm.
You know, like, yes, they are having a mental health issue. Yes, it's a significant issue. It's significant enough that they're out of their school, or it's significant enough that like this has been going on. You know, if you find yourself in a couple months here in this same spot, like talk to their therapist, but you know, if they're failing a class, it might mean that they failed that class.
Yeah.
You know?
And as you say that gives me anxiety. Like my kids are little to
Yeah.
like they're in pre-K and first grade. They're not gonna fail, but like
Yeah.
the class, like then I'm like, ugh,
Yeah.
no, we can't let that happen.
That's so interesting that our own egos then do get
Mhm.
pinged if we see our kid suffering or not living up to
Yeah.
someone's expectations. And then we think, I don't want anybody to see this or hear about it.
Yeah.
We have to go save them and fix it so that I don't have to tell other people that Junior failed. But
Absolutely. Yeah, and I will say too, we were talking about social media and like what that means for kids. I think that social media and what that means for parents is also like no small thing, you know? And so, I mean, nobody is gonna put on like Instagram the like, I don't, I'm still on Facebook, which I guess is like really uncool, but I don't care. I like it. You know, I
Old
like it. I think it's fun.
yeah,
It's how the three of us met. So
right.
Or keep it.
yeah. But I mean, I think that does like amplify things though too, because it's like, you know, your kid's having a hard time at school back in like the 90s, 80s, you know, your classmates know about it. Maybe the classmates tell their parents, maybe they don't. The teacher knows, you know. I don't know. I'm like Facebook friends with like people I worked with like 16 years ago,
Yeah.
you know, and the pressure to be so like perfect in all these arenas, you know, I think it's pretty unbelievable.
Mhm.
Well, and even like outside of the social media stuff too, like thinking of, okay, my kid's gonna fail this class because they're not going to it.
Mhm.
Maybe this is weird, but I automatically go to like, that's gonna create so much freaking more work for me.
Oh
Like
yeah, of
then you're
course,
gonna
yeah.
have to do a summer class and I'm gonna have to figure out how to get you back and forth from there. Or then we're gonna have to do more parent teacher meetings, or then we're gonna
Right.
have to work on your IEP, or then we're gonna
Mhm.
whatever. And I'm like, I just don't want more on my plate. And
Yeah,
that's like I was saying, that's
understood.
when we, I think, get to the point where we're just like,
Totally.
fine.
Mhm.
Mhm.
Yeah,
Because I
totally.
think it's different. Like most households have 2 working parents now.
Oh,
Like,
totally.
not all, but a lot do. And it's like, that's different than how things were. We don't have one person who just has the time to take care of everything. It's like, oh, everybody's out of the house. Everybody's has stuff, and adding extra stuff feels like there's no space. So we get
Yeah.
caught in this, like,
Totally. Well, and I think that like parenting too, there's all kinds of places, and no one's gonna always do the like, well, today we're not gonna give into the tantrum, and every day we'll never ever give into the tantrum. You know, like sometimes you get into the tantrum, that's fine. It's not the end of the world. You know, like by today my kids should have had 2 baths this week. We've had like, and by 2 baths, there's 3 of them. So, 6 total baths. I think we've had a total of like 4.5 baths this whole week. Like sometimes your kids are smelly.
playing outside. You're not getting dirty. It's fine.
Right. It's like cold out, so they're not getting super sweaty at least. But I mean, there's no perfect.
Yeah.
I think that's
yeah.
Sorry, I was just like, that's a big thing that Miranda and I talked about that started this podcast. Was we text each other all the time, like, this just happened, what do I do? Or like, this happened, this is how I reacted, did I totally screw them up? And we realized that a lot of it is like, we're looking at Instagram at the like gentle parenting and like all of all this stuff that we're just like, my kid is not going to respond to that.
Yeah.
And then we're just like, oh, well, then what do we do? That, like, where do we go? And the more we interview experts like yourself, the more we're hearing like realistic expectations count for parents too.
Yeah.
You don't want to show your kids perfect, because you're then showing them an immeasurable hierarchy of like, they're never going to live up to either then. And it's just so hopeful to hear that, like, yeah, if 4 out of 6 baths happen, is everybody fed? Is everybody safe? Is everybody,
relatively not smelly?
Yeah.
Yeah. There's you guys are therapists, so you guys have done all your like theory and understanding different kinds of things. There's a fellow who's a psychoanalyst, who was a psychoanalyst. I think he has since died, but he started as a pediatrician, Winnicott. And he talks about wanting to have like good enough parenting. The goal of like a parent-child relationship is that there's good enough parenting. You don't want perfection. You actively don't want it, because it doesn't teach kids how to fail. I'm trying to see if I can pull up a quote from him really quick. I'm not going to be able to find it fast enough.
We
can maybe I'll have to. Yeah, maybe I'll try to email it.
You can add it into the like notes on the.
Yeah, I mean, part of what he talks about is that in every situation, he would always prefer the parent that has known hatred, has known rage, has known grief, has known devastation, rather than, and I think he says mother, because this is in the 50s and 60s, but I'd always rather have the mother that's known rage, anger, hatred, devastation, rather than the mother that has never known any rough edges. And I think there's something really beautiful and true in that. That like, if we as parents, as people first, can like know our hardest selves and know our hardest parts of ourselves and know the parts of ourselves that are hateful, we can be with our kids and their parts that are hard, that are hateful, that are rageful, that are completely lost. But if we don't know any of that in ourselves, or if we say like, oh, no, that's not in this household, and what is this in our household, we live, laugh, love, like that's not real. Life has a lot of pain in it, and we can be with that, and we can be safe with that.
In this house, we rage and we break TVs and we scream and throw stuff.
Right. Yeah, sometimes we get mad, we don't talk to each other for days, right? Or John Gottman, family scientist out of Washington, 70% of couple problems or problems between a diet cannot be solved. And the thing that like keeps couples, keeps parent children like happy together is that you like each other. At the end of the day, it's not about like coming to some perfect solution. It's about I really like this person.
So what we have to do is like our little jerks.
Yeah. And know they like us, even when they're like, I hate you.
Yeah. Yeah.
My oldest tells me he hates me a lot. You're
Yeah.
the meanest mom, I hate. And
Yeah.
then it's bedtime and he's like, can you lay in my bed and snuggle with me a little bit?
Yeah.
Thought you
Yeah,
ate,
for sure.
but sure, I will.
Yeah. And I mean, that like most intimate relationship will have the biggest feelings that our kids have put on us. I hate you. I want to kill you. Oh my God, I love you so much. Don't leave.
The emotional garbage cans. We're like emotional punching bags.
In some ways, yeah.
Yeah.
We get to see the whole person and the whole of their experience. And sometimes it's really painful to view that.
Yeah.
And we don't have to expect of ourselves that we're going to handle it like perfectly, because that wouldn't even be helpful for them if we did.
Exactly. Yeah.
I love this. I feel like each episode we're like lowering parental expectations.
Yeah, realistic
I say it like that, but
like we're learning that realistic expectations of ourselves is probably the most healthy thing. Us and our kids.
Yeah, absolutely. For sure.
I
also just put in a plug. I want to put in a plug for parents doing their own therapy. Like, man, if you can find somebody that can like be with you.
So helpful.
So helpful.
So helpful. On all levels.
For
my
sure.
gosh. Well, we so appreciate you giving us this time and all of this. And this was so fun. Such a different perspective that you have working with such like high acuity stuff. And I loved it. It was so great to chat with you and to meet you.
Oh, great. Yeah, so nice to meet you both too. And thank you so much for having me.
Thank you for coming.
Sure.
All right. If you liked this episode, if you like other episodes, if you like anything about us, literally we'll take anything that you might like about us and we will accept your 5-star rating. We will accept your follows, your likes, check us out on Instagram, Facebook, Spotify, Apple, YouTube, and your local Hy-Vee.
With a crabby kid who does not want to be there.
Yeah.
And in the Walmart parking lot pickup aisle. All right. Well, thank you so much. It was great to meet you.
Yeah, thank you so much. Great meeting you guys too.
Bye.
Take care. Bye.